Senya akwanya say ye ka COVID-19 ho asema de mesre ye communicators ni experts eni obi bia e fa no ho ne say ye be assure ye be ma nipa de senia hu say enye hu senie e wo say tie no because the moment a bra ye be ma nipa de senia hu say e hu broso no I think say enukura to me ku sen yare no yare we ye yare a mfa say ba busumi ba kone fa achi ni na eba ya hyase na tre na ne trade ni mu no so na eku ni padodo banyame ncha de ne amene ukasai recovery rate no I think out of 176 ni anya almost 70,000 plus a yare ne chiemu a omon free omon kwa kutomo nsam death rate na asat na amene ukasai se nipa omo fa yare hu no eso tiba. Another significant thing yenim say bia Africa ba bia Asian intino e boy no so we World Health Organization or more situational report 54 which is as at 14th March. Apart from African region no Egypt any Morocco free Egypt ni Morocco no Eastern Mediterranean region. Now for African region now Algeria kan na Algeria is the only country in the African region based on who report no wanya ebinum a omafrim. Chira won say sub-Saharan Africa no even though yanya South Africa or highest cases death rate no yen record obi obia enwuye na ye be bisa say die na bia obia enwuye there are many statements I report say bia immune system is stronger. There are also statements say bia African immune system stronger. There are many things and so say bia na your temperature because me kind ba bia no say the virus cannot last within a temperature of 26 or more degrees. Say bia a tohakra say temperature no so into me end lasting.
And intina binum say e ma dry na omo de we awiti no. We are na we mia so de hu ni mo.
And inti somewhat in Africa no e favorable America kra. Inti me de me catch rein communicators say nya sa konya let's educate our people on the basic precautionary measures e be take care e be boyen. Me kan ba bia na omo kire say individually anopa bia so hold your breath 10 minutes. Who hold your breath 10 minutes because a lung disease
10
10 seconds rather, sorry. 10 seconds. That's it. 10 seconds. That's Ndi adopa me body me tika mo me ba me sheda hold your breath no 10 seconds. Ehun say no normal. You see anopa bia no so ra no nsuo hia na ase bia nsuo a ye de nchina frem. Na nom kakra. Koso anum nsuo because the more wonum nsuo na say yare ne bi wo hokra na pam yare de ko uyefun mu ne ne manema. So let's educate and let us be let make sure say obia be free na more education no e ma hu na e wo system no afri mu. You see tike say ye hwe sa yare yi e sha ase a ye titi cases yi e can say either the public health specialist and now say experts no e can say omu the information be ACN sana me hu no and as a bia so they are not educating us well, and if they don't educate us well it had economic implications. Me te say na minia Freddy ka say paps ne nuema nka yen closing it down. You see, when we begin to talk that way, closing down some of these things, you know, it has dire consequences on our economy.
The approach to say you better stop yare say you better restrict movements, they discourage gatherings.
You see,
and so and intina yakwa sorry so intina yakwa mosque so intina say funeral gatherings and weddings near the no yenhwe no. So pub so your place among for share. It doesn't it fall.
It has a ticket. Me know ya drink say o sha say no boy my mind be so the omo ye. And I hear ya close neighbor Nigeria. I don't think after we record 2 cases no omo close down everywhere. South Africa na meti here Ramaphosa Cyril no say free nere kono or close schools down. Even China crown na 70 critical no. Omo close everywhere down. America na me no ka say UK ye close schools no be down to disinfect ye we are sorry open. There are measures put in place, but say hana ye can close that economically no ye lock down ye country no den so aso boni bebre bear in mind say me nua Fred me ya adwen say oman no ye nheda em produce ya ho niema say wo ye produce ya ho niema nti niema no bi wo ha ye kra ne ba na ye kra ne ba no so no na say wo ka say wo close obi anya ewe a one economic implication. So let's watch it economically apart from say disease no. Now maybe asama ba ko mpese make say no mampanyi
say. So do I get the point say ense nkaye wholesale?
Yeah, that is how
that's swift and
you see there are other researchers say the ebe gina so am why in wholesale no. Then you free be epidemiologically relevant region or area. Say be incidents no. Unim say sa area hanom no de ebeba ebetre. Nti e was say so is the internal make say be na health aspects no and say be o surround the president no. Omo nka no kra ni nyina nkyere because if you close the whole schools in the country down, they tells us that oman ni nyina no epidemiologically relevant areas or mining incidents no which is not true because most of the incidents I record are imported. Incidents are really free by local transmission by say there's community acquired and I say locally no be a mini friend Eddie Amame and I say or the amount one yenti be that they are tinning in Eddie Bano obi ofira manone or the aba proactively
no buy no be wuremu ye nhu no bet member so buy wuremu akwa sorry akwa mosque akwa baby in the said be ntinade no yen disperse crowd no na fe yen track nya sam ntina ye de
me no ya adwene fa bi so you see earlier no statement say buy say ye catch your mind me nya the politics ye can up your mind say especially me catch your mind say because you are any train no the anke also here proactively ni say o mind no best stop flies from other countries, especially virus prone countries no was anko mine no stop omo eni kwan so moba e ya hwe han yet na ase ema omo da so wuram ne amenu kasai other countries like Kenya, other countries like Ethiopia, even African countries even South Africa are banning flies from other countries ye bandi ye the restrictions and atutu so say opa bra na say opa see you see nti hono be proactive measure yan take na yan take it say adena ba mine mu say you take active measures aba mine mu nti you take say be correct ya tiki ya close schools down ya close churches down which some churches are obliging omodi ye aduma say you close it down to what level or to what next because one thing me who make us be a health aspects nin kind of crunch and say na me no ka say omo e wo so omo hwema yare entre no health professionals and health professionals entre say doctors any nurses nko your omo laundry experts or musisi nuema or facilities your lab expert your omo ni na mo customer care ni hospital no your many ankrofo bibro mo ya adwuma ho bisa won say omanya akade e wo so mo di adwuma na dabi
so cry because government are sure over and over again say and no man can say bias who can specifically we see bibi ho a won san kan ye no draw more attention
ne amenu ka say health person bia madam for be send message say babi o ye adwuma me mbodi because ye nim kroma say ne target amanfo babi o ye adwuma ne amenu ka say PPs MI akade e wo so de adwuma ne mai na yemfa no ntunche MI yemfa no ntunche so wo san tie say ye close schools down bia case Legon case is a reactive measure because Legon yanya one person wanya sa yare bi na ye close Legon down question visa and say to what next ye close down what measures are you putting in place and spreading you because still na make us nkra no school more we are not disinfecting the school
ye stress so free ones
minia
they should move omo free ones na ye betima disinfect
they shouldn't move
make us all say ye close
omo ye day students no
omo da so school ho
omo mo ye bo residents no mutina campus
so ye disinfecting area
I know ye legal authority direction but president
president ye no as to
and there am kivas for nya so no so mo kofi so and this president is
president ye no came after school ye and this president ye supersede
and they are supposed to go today this morning
so now if they are supposed to go home ye take president initiative no which is a reactive measure which area no yanya one case say yes omo nyina san kofi what are you telling us? A bit more, but say, Binum Crabit ma carry this vector and apathy, and the coffee. So, measures in the year, make us say, the health aspects, no, I think.
But in specifically, we know Sankayan and Sankadena, you bet me.
Maybe, so take your own only more numbers or contacts are from, but may critique.
But I say you didn't come on.
May critique your system and say, it was say, yes, solutions to these problems well because say ye close to down I think we are creating that panic more than solving the problem take me for you see aban ka kire yi nyina say oyo man ka kire yi nyina say afa ho say yenko yes GPRT protoa and as a concern and all road transport operators. Yes, omon supply hand sanitizers. Bearing in mind say earlier no create that panic into hand sanitizers kwa boy ade na eton 2 cities no na metie na ese bi no ton 30 cities 40 cities.
Oh yeah.
What do you say ya? Question me bisa me ho say earlier kane no 2.3 million na ban dedicated say or they fight sa coronavirus yi. Dey na omode ye dey pa na omode ye because sanka ye proactive nation bra ye ko to 2.3 million earlier no nkaba no niema bi ho a akade bi ho ankaya to a ye die sisi vantage points a enhia se GPRT union na se concern beto ye no minor to wo dia ne se ko horonsa because yanya education no UTV educate ye se yen ko horonsa minor to ye o si ankran to die ne kire se ankran no beto. That's another question.
And ankran fa die when sika
na to so 2.3 yen hu ba biafa now ye the 100 million
no hu dey na fa
oh senior
when hu dey
senior wo de wi a kire yen de mato
dey na ato
na mo dia ye
dey na mo dia ye yen hu de afa
100 million
now 100 million
no the 100 million be come
100 million beto ye ba mi team 100 million ticket ye ba mi team ni say ye o mai mu ha people benefit from poverty so o kai ahwe o minim say bi nua Fred ni Honorable Carlos omo to kwan pa okosrema ye more than 200 NGOs omo se omo ku hia o na mom hia kumu no ye ka hia yo pa na e wo srem nti ya question mi say say hia na mo ku no yi sa na 100 million yi so abeye
na za ku no wie ye
sa na 100 million no ku no be wie da be sa na 100 million yi so sa na mi susu no because bra 100 million ne beto ho no yanya interministerial committee a bia omuhia abrina bia na omoje kakra
allowance be kum
yes omoje kakra oh tiki omoje kakra
Ben
politics
an army does not move on an empty stomach. Obi asori enra kwesi
that is the problem
enra kwesi sabi obi adadwo no Minister for Information sorry finifi
doctor ya catch up 100 million no money drop
sabi onti oba ebi kura no wa nkofie na se odidi kakra na ayede
okay na so didi kakra na ayede we see ansa na obedidi no de ehia kese ansa na obedidi ne say akade na ehia so de bema odidi kakra na ayede ansa na obedidi tike ansa na obedidi ne de ehia ene say obeye de se ene de fata se ne be da yare ne ntre ne amenu ka say
na me kala sumrem
o da ami wie ne amenu ka say obi mai nyinafo say yare no ayehu but question Ghana Health Service bisa ana workers ni bisa ne say ne health professionals e was so mo boy ho ban every year they are not insured omu PPIs ni ho nra metie mo sister station bia na mo kiremen e kra ka say omu PPIs mai na amenu ka say tiki 1 month ni in service training course wo ba bia na Honorable Carlos be di achi but in service training course wo ba bia Ghana Health Service and in training obia emfa yare ho that is a fact tiki mu da mo fro bia Ghana Health Service has not trained a single individual.
Oh, really?
Minia. Has not trained a single individual. Now, one training will be for your at the local level. PS, no, one training will be doctors, one training will be.
But Benny, so more training, I'll be there.
Messi, Obi Mama report to neck. From upper
or no come front line for
maybe NDC credit.
Now, on front line, when you say you're close to the whole nation, you're close to the whole nation. Mamempa, Adeba, come say who here.
Just a point now, Carlos.
Concluding, no, presidency local assemblies. I mean, okay, local assemblies, no, and Shema, I didn't cost on the Baby say, hey. Local assembly is your mumbo number. President say show mama ye omodi ensika. No, yeah, that is it. That is it because local assemblies na mu no. Adiba e omna nkaso mu use health promotion officers to educate us and sensitize on it.
Ben,